So thank you, Dr. Arty, Dr. Luna, Dr. Green, and Mr. Young. Thank you so much for being here today and for your very thoughtful comments. And let me just summarize, I think, what we've heard today and what we want to make sure that we're communicating. Here's the bottom line. We can be open by also being careful. And let me put a more finer point on it. We must be careful to be open. And we can be careful. We're not helpless against the virus or the variant. We, you and everyone, has the tools right now to fight this virus and the variant. The vaccine, the vaccine, the vaccine. That's the tool that we have to help ourselves, to help our family, our community, our city. And it works. It's effective, it's safe, and it will save your life. As Dr. Arty said, 99% of those vaccinated have not gotten sick. 99%. We can't guarantee 100%. There's no risk-free vaccine. But that is a very powerful data point that we need to make sure that we talk about. And conversely, 97% of the people getting sick now, going into the hospital, and dying are the unvaccinated. When I heard that, it said to me, we have to keep pushing this vaccine to people all across our city. The vaccine remains readily available, it is free, and it is safe. And as you heard from Dr. Green and also heard from Mr. Young, if you are still hesitant, talk to a medical provider that you trust. Unfortunately, there's a ton of misinformation that's out there on the internet, on Facebook, other social media channels. And we're not going to be able to combat that effectively, but you can by getting the real information, the straight dope, if you will, the facts, from a trusted medical provider, not from some person who'd post something on Facebook that may or may not be true and in many instances is misleading. I want to especially talk to residents in the 6 zip codes where vaccine uptake remains below the city average. That's 60633 South Deering, 60621 Inglewood, 60649 South Shore, 60620 Auburn Gresham, 60644 Austin, and 60628 Roseland. Those 6 zip codes remain below 50% vaccine uptake. That's a challenge, but also an opportunity. The challenge is you are playing with your life. As we've seen, not only here in Chicago, but across the world and across the country, the Delta variant is real. It is vicious, and it attacks those that are not vaccinated. Don't take that risk when the vaccine is readily available. We will bring the vaccine to your home. All you have to do is call and sign up. We need people in these neighborhoods, South Deering, Inglewood, South Shore, Auburn Gresham, Austin, and Roseland, to get vaccinated. And as Dr. Green urged, if you remain hesitant, if you have concerns about whether or not this is the right decision for you, contact a medical provider that you trust. Get information from somebody who knows, not somebody posting on the internet or social media. These grim statistics, 97% of the people dying in Chicago are unvaccinated, should be a wake-up call for those who are still on the fence and hesitant. This is entirely preventable. We have the tools we need. We are not helpless against the virus or the variant. We need people to step up. We need people to max up and vax up. That's what we need to have happen here today. But stay with us. We are providing information on a daily basis about what the status of things are in Chicago. Dr. Arty is going back to 2 times a week with her Facebook session. But there's plenty of good information about what's actually happening. And I would also say, members of the media, if you have questions, come to us. We will give you a deep dive briefing. But we need to make sure that actual information, actual facts are getting out to members of the public, not whipped up hysteria. So please, if you have questions, ask us. We'll provide you with a briefing. And ladies and gentlemen of the public, please make sure you continue to do the things that you know work. We're not where we were in March of 2020. And we have a ton of new learning. And we know exactly what we need to do to protect ourselves. And that is wear a mask and get vaccinated. Ladies and gentlemen, with that, I'm happy to take your questions, or any of us can take your questions.
Thanks a lot, Mayor. Appreciate it. Members of the media, you have questions for the mayor. My colleague, Ryan Johnson, on that side, will give you the mic. Let's kick it off with Mark. Go ahead, Mayor. ABC.
Good morning, Mayor.
Good morning.
Any plans to change this mask recommendation into a mandate, and how satisfied are you with the protocols that have been followed at Lala this weekend and other events to possibly avoid another surge?
All right. So we are encouraging people that are inside to wear masks. That's consistent with the CDC guidance, and we believe that that is the right guidance. We're not at a point yet where we believe that we need to take other steps, but inside, just as you all are here today, mask up. That's critically important. And yes, Lala, 90% of the people that have gone through the gates in Lala are vaccinated. 90%. Dr. already showed the charts about where we want to be. That's where we want to be. 90% of people at Lala have been vaccinated, and hundreds of people who either haven't been vaccinated or haven't shown a negative test within 72 hours have been turned away. Lala, I think, has done an incredible job, certainly working in partnership with the Department of Public Health, but they've taken it seriously, and thousands of young people have been vaccinated because of Lala. We worked in conjunction with them weeks and months ahead to incentivize people to get vaccinated so that they could be and enjoy Lala safely, and we feel very comfortable about that partnership and the protocols that are in place on a daily basis at Lala.
All right.
Other questions?
From the Hyde Park.
Thank you. Two for Dr. Arbody, please.
Mm-hmm.
They're long, bear with me. Given that some fully vaccinated people can carry the Delta variant in their noses and mouths, shedding as much of it in some cases as unvaccinated people, should even vaccinated people be avoiding places where masks cannot or are not worn, like bars, restaurants, and probably nightclubs? I want to say on background that the Israeli Ministry of Health has found that two-shot vaccine immunity is now 64% against infection and symptomatic illness of the Delta variant. And a study of breakthrough infections involving Israeli healthcare professionals found that 19% develops long COVID.
So, lots in that question. Basically, where we are is that we know and have known the whole time that the vaccine is not 100% protective. It remains highly protective. Certainly, we're following that Israeli data. We're also following the data from 15 other countries around the world that have been doing this well. In the UK in particular is where I think we've been focusing a lot, because they were one of the first settings that has very good testing in place to really see Delta come in and take over. We saw Delta really tear through India, but it was hard to get some assessments there because they just don't have as much of the medical infrastructure to really understand it. And what we saw in the UK was certainly a big increase in cases, very, very big. However, the comparable increase in hospitalizations and in deaths was much, much lower. And that was with the Delta variant in place. The recommendation for the masks is partly because we know that it's possible for people who get infected with COVID, even if they've been vaccinated, it's certainly possible to spread it. We are still learning, though. I want to be clear. This Provincetown outbreak got a lot of attention, rightly, and it got studied. But where we look at Provincetown, one of the reasons it got attention was that it was in a setting where a lot of people were vaccinated. There were hundreds of cases associated with it, fewer than 10 hospitalizations, 0 deaths, and the case rate is back down to basically where it was. And where we think about risk benefit and the potential for sort of opening, closing, and wanting to make sure we can help protect people while still remaining open. The masks are the most important thing. Really, at this point, I have to make the recommendations for the whole population, and different people will have different decisions around other indoor activities. For me, I remain very comfortable in indoor settings. I'm putting my mask on. I was at dinner last night. I took my mask off, when I was eating, just like I did all of last year. And I hope, we got really pretty used to wearing these masks. It's not forever, but it's while we get through this Delta surge. And so I think if there are people who perhaps have someone who is not able to be vaccinated or who is immunocompromised and they're particularly concerned, they may want to be more outside right now. But the most important thing really is to get vaccinated, and then secondly, asking everybody to wear a mask.
Secondly, where do the projections for the trajectory of this surge go as far as where they're coming from? You say that it will be similar to the Alpha variant-driven surge in Chicago, but the Delta is orders of magnitude worse. How does the surge affect the Protect Chicago outreach efforts, which are only in 13 community areas at this point on the ground? And I'm also curious about where the rollout of the city worker mandates is at this point. Time seems to be of the important, given how bad it's spreading. And
What was your last question?
the mandates, when are they going to be rolled out?
So, okay, lots of questions in there too. So first of all,
Aaron violates the question rule.
so you were asking about mandates, you were asking about
And outreach efforts.
outreach efforts, and those are the two. Okay. So first, related to outreach efforts, we continue to do outreach absolutely all over the city. As you saw, there are, really just a couple of zip codes in the loop that are 90% vaccinated. So although the most intensive efforts have been in the 13 communities where we remain, less than 60% vaccinated, and, you heard the mayor say there's 6 that are still not even 50% vaccinated. We are working in partnership with all kinds of community organizations, with the Chicagoland Vaccine Partnership, et cetera. And we continue to do events. We're going out. We were at Fiesta del Sol. We were at Lala. We were, all over, signing people up for at-home vaccination and then bringing vaccine to settings where we know people are excited to get it. Swaparama is today. Right. It's been a great event for us week after week. People come. They're happy to get vaccinated on the spot while they're going about their business. And so we still are doing a lot of outreach. And if people have ideas for other ways to get people, signed up for vaccine or work on those barriers, we're always interested to hear about them. I think related to mandates, certainly there has been a lot of focus on this, and I think appropriately over the last few weeks to months. We have seen companies, we have seen healthcare settings, we have seen some municipalities, we have seen some states, we have seen the federal government all make that decision, but different flavors of this, right? So whether it's Google just did a mandate really with medical and religious exemptions, but without sort of a testing option. We've seen some other places think about testing options. There are conversations that we are having about that here, but there are a lot of stakeholders involved and a lot of decisions related to operational, what that would even look like. So we have not made a decision at this point, and we certainly continue to, continue to discuss this.
Thank you very much.
Yep.
Judy Wang, WGN.
We've spoken to a lot of Lala fans in Grant Park, vaccinated and not vaccinated. You've seen the pictures, very few people wearing masks. We, counted a handful at some point. People flooding CTA stations on their way to Lala, no masks on. Are you still confident, given what the CDC is saying, the data is suggesting, are you still confident that it was not a mistake or that you decided to go ahead and go with Lala still?
Well, look, again, context and facts really matter here. 90% of the people that are in Lala are vaccinated. We spent a tremendous amount of time working in partnership with the Lala folks to make sure that we incentivize people to get vaccinated. And also, folks, let's not forget, since we fully opened up in June of this year, we've had millions of people attend outdoor events. Let's talk about the number of people, 40,000 max at Wrigley, and then another at guaranteed rate. We've had big festivals all across the city all summer long. I understand the fascination with Lala, But the fact is, in this city, because of the efforts that we've made to get people vaccinated, we've been able to open, but do it with care because of the vaccinations. So I feel very good about what we've done. Obviously, we'll know a little bit more in a week to 10 days. But we have to keep pushing the fact that the unvaccinated are the people that are at risk. The unvaccinated are the people who are putting themselves at risk of sickness, hospitalization, and certainly death. And they're not only putting themselves at risk, they're putting their family members at risk. So getting people vaccinated is critically important. And let me just put a little finer point on the question that Aaron asked. We are not just focused on the Protect Chicago Plus neighborhoods. We are all over the city. We follow the data clearly, as you've seen today, and as you've seen really from day one that this virus came to our city. We're focused on those areas where there's lowest uptick, but we are not only focused on those 13 Chicago Plus neighborhoods. We've made great progress, by the way, by being intentional in those neighborhoods, by putting equity at the forefront of our vaccine distribution strategy. But we follow the data, and the data tells us that those 6 neighborhoods that I identified earlier are the ones we've really got to make sure that we give even more emphasis to, because we're not seeing the kind of uptick that we need. If we can bring those neighborhoods up and we continue to see the uptick in other neighborhoods across the city, we're going to continue, I think, to be well positioned to recover and fight back this latest little mini surge with the Delta variant.
Mayor, Marissa Pross, CBS.
Okay.
2 questions for Dr. Arwady.
Oh, one other thing I'm sorry I forgot to ask. I forgot to answer. CTA. Do not get on public transportation in the city without a mask. Do not. And we are looking at conversations with the CTA to look at enforcement. I do not want people getting on public transportation, whether it's rail, whether it's bus, without wearing a mask. It's not wise. You're putting yourself at risk. You're putting everybody else at risk. What happens on a bus or train? That's an indoor environment. What have we said? Wear a mask inside. And that applies to CTA rail stations, buses, and rail cars. Wear a mask. And I hope that we don't have to get to a point where we're writing people tickets, but if we need to get the word out and to make sure that people are compliant, we absolutely will. But I want people on public transportation in this city coming in or going out to wear a mask, period. Why would we put anybody at risk, not the least of which is those CTA employees who've worked their tails off through this pandemic, through thick and thin, to make sure that people could get to their work, to their job, to leisure activities. They deserve our thanks, but really what they deserve is people wearing masks. So public transportation, put a mask on. Go ahead, Dr. Allison.
You briefly addressed the CDC study out of Massachusetts. I want to circle back to that again because
Sure.
I think there's a lot of discussion and perhaps alarm from people who are fully vaccinated who see the CDC is saying 74% of those infections were in people who were fully vaccinated. Tell us, what is your takeaway then? Does that not deserve some concern?
So lots of context here, and it did get a lot of attention, I think, before the CDC had formally released the data, frankly, and there were some assumptions and generalizations, I think, that were made just in the way that the news got out a little bit. So what we see in Provincetown is, first of all, it is a pretty it's a situation where you are in a highly vaccinated setting. And one of the reasons you hear us talking about the fact, 99.9% of the people who have been vaccinated have not gotten COVID is because the most important thing to measure is actually not the percentage of people who are diagnosed who get COVID, but the other way around, the number of people who are vaccinated and then get COVID or get hospitalized or die. And it's important to put that in perspective. Certainly in this outbreak, it was one of the situations where there was the ability to do some more lab testing, which is important. I think it may have gone a bit far in terms of assuming that what's called the CT value, which is an approximation of the amount of virus that's in somebody's nose, is a definite corollary for how contagious you may be, because in fact, it's not just your nose, it's your nose and your lungs. And so we know that data, we see that data. Partly because of that data, we've got the mask recommendation back. But what I don't want people to take away from that, because we have not seen this around the country, is that the vaccines are not working. And I think that was, unfortunately, just a conclusion that folks came to. If we were in a setting where 100% of people, or maybe not, 95% of people who were vaccinated, a huge number of the COVID cases would be in people who are vaccinated, because 95% of the population is vaccinated. Does that make sense? I know it's a little bit confusing when we talk about it, but basically, this was a setting where a lot of people were coming to town, and we've seen the numbers, come back down, and again, not seeing the serious outcomes, really different than earlier outbreaks that we've seen. And even among those folks who got vaccinated, very rarely were they hospitalized, and no deaths.
So, Doctor, can you also just talk a little bit to what that PowerPoint deck was and what it wasn't?
Yeah, sure. So the mayor's just referencing, so there was an internal CDC PowerPoint deck that was, I think, leaked, I'm not entirely sure, on Thursday. It came out on Wednesday or Thursday, in the Washington Post initially. And I will tell you, I was actually fairly alarmed reading the media coverage of this before I had seen the actual PowerPoint. When I got a copy of the PowerPoint and looked at it, 95% of what was in there, we already know. And there actually it was helping put into context what do we know across different settings, and then sharing specifically some modeling that's been done. And then there were some words on the slide that I think people, it was not meant for public consumption necessarily, and people perhaps, understandably, look at the words on the slide and sort of report it as such. And so there was speculation, for example, might the Delta variant be more, make people sicker? I want to be really clear, that is not proven at this point, right? And it's one of the things that continues to be investigated, but the way that was leaked and then shared, I was way more worried reading the media coverage of it, frankly, than I was when I actually saw the data. And when I saw the data, the only really new piece of data was this thing about the CT values, this thing that showed that in this Provincetown outbreak, again, relatively, they tested 100 and something people, so this isn't 1,000, this isn't like an enormous study. You saw about the same level of virus in the nose, whereas previously with other variants, we had seen somewhat lower amounts of virus in the nose. But is that in and of itself something that makes you, that makes me hugely concerned about where we're going? No. What would make me hugely concerned about where we're going is if we really saw the vaccines not be protective, and especially not be protective against severe illness. What we're talking about here, where we are right now in Chicago is honestly like better than a typical flu season. And even during that surge in April, it's consistent with a bad flu season. And what we see is that people who are able to get vaccinated, just as we see people who get vaccinated against flu be much less likely to be hospitalized or die, we're seeing that same scenario. So we'll see we're going to keep seeing surges of COVID, right? I think as the winter comes on us, the fall and the winter, I would expect we'll see it coming back again, just like we've gotten used to having cold and flu season. I think we'll have cold, flu, and COVID season. But what we will see is folks who are not vaccinated largely having those severe outcomes. I've seen nothing that suggests otherwise, and I think we're in a good place as far as the recommendations of the vaccine plus the masking.
So we talk about groups of vaccinated people being together, and our recommendations right now are that if you're indoors to wear a mask. Well, what if you're going into an establishment that only lets vaccinated people inside? Do you still need to mask up?
So and we are starting to see that a little bit, I think. And certainly, when you are in a setting and you can know everybody is vaccinated, we have, the risk is very low in that setting. That said, I think we're just at the beginning of figuring out what this is going to look like. You've heard us say it's a recommendation at this point, sort of not a mandate. Certainly, I remain, I feel comfortable when I'm in a setting and I know everybody is vaccinated. But our recommendation remains right now that at indoor public places, everybody is masking, and that is the recommendation at the population level right now. Again, not forever, but for right now.
Thomas Shuba, sometimes.
Hey, Mayor, I know you keep going back to the vaccination rate of the festival goers this weekend.
Mm-hmm.
I saw some videos where, people at the gates are basically just waving these folks in. They're just holding up their vaccine cards. Is that enough scrutiny to make sure that these aren't fake or someone else's?
I heard about that, but I was at those gates too. On Thursday, I was at the gates again yesterday. So we've been very clear with the LALA folks. They have to have tight security. Dr. Artie, I think, indicated that she went a little bit incognito, didn't have all of her information, looked a bit different, and they put her through the paces. So we feel comfortable that the protocols that are in place are solid. We know that they've turned away hundreds of people over the course of the event. And as I said, from the time that we fully opened up on June 11th, we've had literally millions of people gathering at large-scale events all across the city, ball games, festivals, and so forth. And we haven't seen these large outbreaks. And the difference here with LALA is that they required people to get in to either be vaccinated or to show a negative test, unlike what we've seen in other venues. So there are always going to be people that try to game the system, but I feel very comfortable that they have put together protocols that are working, and we've been spot testing. We haven't just told them, tell us the information. We have eyes on the process as well.
And one more for Dr. Awadi.
Sure.
You were talking about that CDC report that the Washington Post did the story about, and I think one of the alarming things to lay people like me was just the amount of viral load that people are carrying with the Delta. Is that concerning at all with people in such close confines with each other at the festival this weekend?
Yeah. So that viral load data is, that was part of the CDC's change to recommending masking, specifically, though, in communities with substantial and high transmission. I want to remind people of that, because when you, and we've just crossed into that substantial on Friday. It's why we made that recommendation. When rates remain low, your chance of being exposed to COVID actually remains low. That's actually the more important thing. As you see the number of cases rise, there's more possibility that you are potentially exposed to someone with COVID. And again, I would just say we are still learning about how those viral loads in the nose, like how those correlate with the viral loads in the lungs, how those correlate with transmission. So certainly it's concerning when we're reading.
You're streaming live now from Fox, taking a live look from Chicago, Illinois, where community leaders, as well as Chicago Public Health and Chicago Mayor Lori Lightfoot, they're giving COVID-19 updates and also pushing the community to get those COVID-19 vaccinations. Most of our viewers will see a 2-minute commercial break. More nonstop news up right after this.
We're still learning a little bit more about it, and it's mainly just because the Delta is more contagious. We've known it's been more contagious for a long time, and we're still learning, I think, is what I would say. But it's something that needs continued study, and that's one study that was important and needs to be replicated and redone in other spaces, and we may do some of that here as well.
That's all right, folks. Oh, sorry. Sorry. Got ahead of myself. Regina Waldron from NBC5.
All right, I guess, Mayor, if you could talk about this. Howard Brown Health released a statement late last week requesting that Market Days, Pride Parade implement a series of more precautions, including capacity limits, mask requirements. They even pulled out of the festival and going to do everything virtually until they see, stricter precautions. Can you speak to that?
Well, I'm not going to speak for Howard Brown, but obviously, we want people to be careful. That's why we're here today. That's why we've been talking about things related to COVID-19 and protocols and protections that people can take on a regular basis. Certainly if the organizers of those events want to step up what the protocols are, we stand with them. But as I said, the thing that I think I hope you take away from the discussion today, inside is different than outside. It always has been. Inside's different than outside. Outside, we know from study after study that the transmission is much less than inside. And the CDC study, and again, I'm going to play epidemiologist here a little bit, that was intended for an internal audience where they're talking to each other in a very different way than they would talk to the general public. And it's unfortunate that that internal document was leaked because it's created this whirlwind of hysteria that doesn't need to be there. Bottom line is this: get vaccinated. If you get vaccinated, you substantially reduce the risk to yourself, to your family, people in your network. I can't emphasize that enough. Get vaccinated. If we raise the number and the percentage of people vaccinated in the city, the risk goes down exponentially. We know that from the data. There's no dispute about that. Get vaccinated.
All right, my next question, Mayor, is the Biden administration is calling for local governments to pay $100 to people who are still not vaccinated. They say the money can come from those relief funds. Any prospect of us doing that down the line?
Well, we've done a lot of incentives to try to get people vaccinated.
Anything about $100?
So, well, let me just finish the point. We have done free tickets. We've done other kinds of incentives. We've done meals. We've done giveaways. We've done a significant amount, many of which value more than $100. We're at a point where the people who are unvaccinated, we've got to think about different ways to reach them, because those incentives are not enough, clearly. Because if they had been, then we'd see the rates in some of these difficult, in these DIPS codes that are below 50%, we see those rates rising. If it was just a simple question of giving out money, more needs to be done. And more, I think, is educating people about the risks that they face, disabusing them of the disinformation that's on social media, where we see people spinning up all kinds of fantasies about the virus, about the vaccine, and so forth. So we're going door to door. We've been going door to door for weeks. We're offering up information to help people get comfortable, as Dr. Green herself said, and I agree with this wholeheartedly. If you're on the fence, if you're undecided, find a medical provider that you trust. Go on the Chicago Department of Health, Public Health's website. Find the information for yourself. Talk to people who have been vaccinated and find out what their experience is like. But for God's sake, get vaccinated.
That's a wrap, folks. Thank you very much. Thank you, Mayor.
Thank you.